Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Have you been putting off your annual checkup with the dentist? Have you been putting off your annual checkup with the dentist? No, you probably skipped it altogether, didn't
No,
you?
not at all.
Well, if you have either one of those, you're not alone. A recent survey of 2,000 adults in the United States found that 6 in 10 adults were scared to visit the dentist.
That's amazing.
Well, it is.
Well,
Strange.
we know that regular dental checkups help us to keep those pearly whites. Good oral health is important for overall health as well. And here to discuss the importance of regular dental checkups is Mayo Clinic prosthodontist. Is that right?
That's
good.
correct.
Yeah.
Thank you.
Dr. Thomas Salinas. I have learned over the years.
Yeah, that was very.
Yeah, good to
that
see
was
you
excellent.
again, Dr. Salinas. Hello.
Thanks. Great. Thanks for having me.
So, Dr. Salinas, did the results of that survey surprise you? 6 out of 10 people are scared to go to the dentist?
No, I think it's pretty common, actually. Looking at the American Dental Association's most recent survey of a number of adults, both vulnerable and regular populations, all have a similar type common fear of the dentist. I think it's related to a lot of their perhaps maybe just lack of knowledge of knowing what's involved or what might be involved. So it's a common fear we see in the United States.
Unfounded, though, right?
Well, I think it is unfounded. I think you can have a number of fears that we're all afraid of. Certainly, the fear of the unknown, fear of pain, fear of lack of control. Those are all common fears that we all experience, especially when we visit the dentist.
A prosthodontist, by the way, you replace missing parts. Isn't that what a prosthodontist does? You
In general,
you have
yes.
a subspecialty.
Yeah, of the orofacial region. So we have various types of work that we do related to replacing not just missing teeth, but missing parts of the jaw and orofacial structures as well. Some folks are missing part of their orbit, their eye, their nose. These can be made actually in a pretty similar fashion as teeth are, with perhaps just different materials.
I'm thinking about the people who are afraid to go to the dentist and the fear of pain or the fear of loss of control. These are, I guess they touch on things other than dentistry. So how can you help a patient to get over those fears?
I think it all starts when we're young, schooling us from a very young age, as this is something that's normal. It's something that is common with regard to health maintenance. Getting little kids in to see the dentist at a very early age goes on throughout life. It goes on through regular practices and seeing your doctor, seeing your dentist. And I think if we can just make that happen in general, I think that gets to be something that people are less afraid of because it's more familiar. Preschool-age children in this country, really embarrassingly, have the highest level of decay in some parts of the world. So, I think a lot of this starts with access to care. It starts with just regular oral hygiene. There's a number of things that we have available now in the dental setting that makes people a bit calmer when it comes to seeing your dentist with regard to sedation and just relaxation techniques. I think dentists now recognize that, and many dental offices have become spas more than anything else. So people are generally in tune with feeling well, and getting the dentist as part of this is just another aspect of it.
Tell us why it's a problem to ignore your teeth and your mouth.
Well, a recent survey, as I mentioned before, from the American Dental Association in 2015 indicated that the most common oral problem is pain across the walks of socioeconomic status. These are hidden factors. It could relate to gum disease. It could be related to dental caries, cavities, that is, and it could be related to burning mouth or a dry oral cavity. For lots of reasons. It could be medication that people take. And if we don't really understand it or get to the root of it, it can cause an oral infection that can be chronic in nature. And again, the same survey showed that the quality of life is significantly less for people that experience oral pain. So there are many things that we can do with regard to making people feel that this is normal, okay? There's a lot of patients out there that suffer with this needlessly. And if we would just have a regular care guideline that certainly the American Dental Association suggests, but people have to understand that regular care is important, just like it is for medicine. So seeing your dentist regularly or a dental care provider regularly will uncover these sorts of things, and it can lead to resolution of the problem in many cases.
What does regularly mean to you?
Well, I think at least having an oral examination every year is a good thing. Seeing a dentist or a dental hygienist for routine cleaning, x-rays of teeth annually is good. Having it twice a year is preferable. That may not be within everyone's reach, but it's what's standardly suggested. And it has been shown that this is something that is beneficial with regard to identifying oral disease early on and addressing it and solving problems that people tend to pop up with commonly.
Dental cavities are much less common in kids than they used to be, aren't they? Because of the fluoridation of the water supply. Now, we didn't have that, and you were on a well, weren't you?
I sure was.
There was no fluoride there,
No.
and we didn't have fluoride in the water supply when I was growing up, so I had a mouthful of amalgam.
That's why my mouth looks the way it does, yes.
So with regard to that, it's very interesting you mention it, because in comparison to some of us that grew up in the 50s and 60s, I think the exposure to fluoride is a lot different. We're a fluoride generation. We're seeing less of it, certainly in young age groups as well. But even for preschool age children, this is something that gets past us. We don't always have access to this population, and getting parental attention isn't so easy. So unfortunately, tooth decay in preschool age children has become an epidemic.
Really?
It has in this country, yes.
And isn't it because parents think, well, if the baby teeth fall out, it doesn't matter if it has a cavity in it or not?
Yeah. Some of it is just preconceived notions. A lot of it is access to care. But I think in this country, we tend to lose sight of that, knowing what we know, that fluoride and fluoridated water supply has indeed reduced the amount of dental cavity formation in most of the U.S. population now.
So my kids get fluoride painted on when they go to the dentist for their checkup. Should I, as an adult, keep getting fluoride painted onto my teeth?
Yeah, absolutely. I think if we all invest in regular dental care, this is beneficial for all of us that still have our permanent teeth. I think it's a good thing. It definitely decreases the amount and incidence of breakdown from tooth decay.
I wish that my dental insurance would see it that way. How come? Is there some discrepancy of whether fluoride is impressive or important for adults or not?
Yeah, I think it definitely does, and depending on the dental insurance, not all are standard, as you certainly have brought up. It is important. It's an adjunct to regular oral care. It's an adjunct to preventive dentistry as well, and I think it's an important aspect even in vulnerable populations. Some of our elderly, some of those that are institutionalized benefit from it. Patients that are medically disadvantaged certainly benefit from it. So as it's part of preventive care, it should indeed be part of third-party coverage, right?
And another reason to see your dentist is that you can sometimes pick up other serious health maladies by looking in the mouth, right?
Indeed. The mouth is a gateway for all sorts of identification of diseases. Some of this has been correlated with other medical diseases. For instance, periodontal disease and coronary artery disease are correlated. It's not to say that it's causative, but I do think that there are certain types of oral diseases that sort of give us an idea of the health of the individual we're examining. So yes, that's true.
How often should we brush our teeth? Once or twice a day?
Preferably twice, if not 3 times a day. Typically, morning and evening are good times to do this. This is the amount of time that probably is equidistant from bacteria developing on the surfaces of teeth. So this is when it's most effective.
Flossing still important?
Absolutely. Flossing is important for lots of reasons. Flossing not only removes debris between the teeth, but it also disturbs the population of bacteria that tend to congregate between teeth. These bacteria take on whatever oxygen is available and reduce it to a sort of an anaerobic or a no oxygen environment. And this is a hallmark of some aspects of periodontal disease.
Electric toothbrush?
Electric toothbrushes are an excellent idea. They do a better job even than I can do with my own manual, I can tell you that. And the way they've become more affordable in this day and age has made it universally available for many more people than what it ever used to be.
Kind of toothpaste matter?
Really doesn't. I mean, you could probably do the same thing with just mouthwash or even just water, salt and water it would be just appropriate. It's the act of brushing itself that takes the debris away from teeth and makes it effective.
Dr. Sheridan used to always say whatever's on sale.
And finally, can you, to ask about that dentist or the tags on toothpastes, can you rebuild enamel on your tooth?
You know, it doesn't necessarily rebuild enamel. It makes it more resistant to acidic breakdown and makes it harder in surfaces. So I think there's some truth in advertising issues that are available, we see every day. So making teeth resistant by fluoridating them and making them more resistant to breakdown is more the key.
Just one more reason to see your dentist. Get annual checkups, the importance of dental checkups with Dr. Thomas Salinas. Thanks so much for being with us.
Thank you very much, Dr. Shives and Tracy.